Hello, this is my anatomy project for the elbow joint. So I use paper roll, origami paper for some of the muscles, rubber bands to connect the two bones, the radius and the ulna, and also rubber bands for some of the ligaments. To connect these structures, I used tape and also glue, and also for the interosseous membrane, which is used by cotton here. And so these are some of the movements: flexion, extension, pronation. I cut a hole here in order for it to actually pronate, and also supinate. So let's get started. So the annular ligament, which is here, connects all the way back to the posterior aspect of the radial notch onto the anterior aspect of the radial notch. So the radial collateral ligament, which is right on top of the connects onto the annular ligament and originates from the lateral epicondyle of the humerus, which is here. And the lateral ulnar collateral ligament, which is here, it originates also from the lateral epicondyle and towards the supinator crest. So on the other side, we have the oblique band of the ulnar collateral ligament. It connects from the medial aspect of the olecranon process, which is here, all the way down to the medial aspect of the coronoid process. So for the intermediate and posterior, which are these two, they connect from the medial epicondyle and to the olecranon process. For the anterior band, it connects also from the medial epicondyle, but it inserts into the medial aspect of the coronoid process. So for the volar radial ulnar ligament, which is here, it originates from the ulnar notch, which will be on this side on the radius, and inserts into the ulnar head, which will be here. So for the dorsal radial ulnar ligament, it originates from the distal dorsal aspect of the radius, which will be here, and onto the distal dorsal aspect of the ulna, which will be here. So for the muscles, the pronator teres, which is this muscle, it originates from the medial epicondyle, which will be here, and the coronoid process, which is here, and it inserts into the lateral surface of the radius shaft, which is here, and this is innervated by the median nerve. It pronates the forearm like this, as we can see, it shortens, and also very weak flexor muscles, but then we can see that it does also shorten like this during a flexion action. And the supinator on the back, so this originates from the supinator crest, which would be here, and also the lateral epicondyle, which would be here, and it inserts into the proximal lateral surface of the radius, is innervated by the posterior interosseous nerve. As you can see, this muscle supinates the forearm. As you can see, during supination, it shortens. So for the pronator quadratus, it originates from the oblique ridge of the ulnar shaft, as we can see here, and inserts into the anterior surface of the radial shaft, which will be here. So this is innervated by the median nerve and also pronates the forearm. As we can see, it shortens during a pronation. So for the brachioradialis, which runs all the way from the humerus down to the radius, so it originates from the humerus, the lateral supracondylar ridge, which is here, and all the way down to the radial styloid process, which is here. This is innervated by the radial nerve and also flexes the elbow, and acts as a very weak supinator. As we can see, it somewhat shortens, but then it is not accurately represented due to the paper. It is very fragile. And also the lateral and medial head of the triceps, which is back here. I did not make the long head for the triceps due to it originating from a different bone. But here are the two muscles that are on the humerus. So this is the lateral head. So it originates from the lateral and more superior aspect of the humeral shaft. And the medial head which originates from the medial surface and more inferior to the lateral head of the humeral shaft. They both insert into the olecranon process right here, and they're innervated by the radial nerve, and they also produce a extension action. As we can see, it shortens. And for the interosseous membrane, which is in the middle here, made with cotton, so it runs along the lateral aspect of the ulna and the medial aspect of the radius to connect both bones together to prevent them from splitting apart and falling apart. So this is my project. Thank you, and have a great afternoon.